In early 2017, researchers from the Center for Fetal Research at the Children's Hospital of Philadelphia published their findings regarding the development of premature lambs in an artificial womb. The concept of an artificial womb dates back to the mid-19th century, where scientists envisioned a system that allowed the complete development of an organism outside of its mother. The most recent and promising model conducted to date centers around the extension of in utero development for extremely premature lamb fetuses, ranging from 100 to 115 days old at the time of birth, which is the biological equivalent to 22 to 24 weeks for human fetuses. Primary hurdles faced by Partridge and her colleagues was the development of a placental system that does not result in progressive circulatory failure due to pre- and post-load imbalances on the heart, umbilical vascular spasm, and the use of open fluid incubators which contribute to sepsis. Due to this, the lamb, of gestational age 105 to 111 days or 115 to 120 days, was placed into a biobag, the main feature of the closed fluid circuit, designed to prevent sepsis by refiltering the amniotic fluid without it leaving the system. Consisting of a polyethylene film that is translucent, sonosolucent, and flexible, the bag allowed monitoring, scanning, and manipulation of the fetus. Watertight pores were incorporated to allow double cannulation of the umbilical artery and singular cannulation of the umbilical vein, which was conducted via a section of maintained native umbilical cord and was mitigated by a combination of papaverine administration and atraumatic operative technique. This allowed connection of the fetus to a low-resistance modified quadrox neonatal oxygenator. This pumpless atravenous circuit, driven solely by the fetal heart, closely mimics normal biological fetal placental oxygenation, preventing edema or other complications due to incorrect venous pressure, resulting in circulatory failure. The nutrition provided via the closed circuit was based on late gestational fetal lamb metabolic requirements and therefore consisted mostly of carbohydrates, amino acids, and trace lipids. With the addition of insulin into the system, there was an increase in substrate utilization and therefore increased growth. All animals opened their eyes, appeared to breathe normally, grew wool, and completed swallowing movements. Addition of daily erythropoietin was required in the system to prevent anemia, which allowed maintenance of normal pH and lactate levels. Cardiac function appeared normal in all respects, along with the progression of lung maturation from canalicular to saccular stages, allowing normal ventilation after removal from the artificial womb circuit. Hepatic and renal function appeared to remain within normal limits, while the brain appeared grossly normal in regard to brain-to-weight ratios compared to the controls. There were no significant changes to myelination, no evidence of ischemia or structural defects, and no evidence of hemorrhage. It should also be noted that there was apparent development of normal sleep-wake cycles. These results offer the potential for improvement regarding quality of life and care for extremely premature infants. These methods in the future may also allow treatment of conditions such as placental insufficiency and fetal growth retardation, and may also allow pre-birth intervention surgery for conditions such as congenital heart defects without the risk of immature delivery as a consequence.